Welcome to Doctor Health Hub, where every episode begins with a doctor's tip you can trust. Today, we'll talk about gastroscopy, what it is, when you might need it, how safe it is, how to get ready, and what happens after. If clear doctor answers help you, please subscribe. It really helps others find this information.
Thank you. We'll explain what the test does, who needs it, how we keep you safe, and what to expect before and after.
So, what exactly is a gastroscopy?
It's also called an upper endoscopy. We guide a thin, flexible tube with a tiny camera through the mouth to look at your food pipe, your stomach, and the first part of the small intestine. It helps us find the cause of pain, reflux, bleeding, or swallowing trouble. We can also take tiny samples, biopsies, so we know exactly what's going on.
When should someone actually have this test?
We consider it when symptoms don't settle or when there are warning signs. Things like long-lasting upper tummy pain, reflux that won't improve, food getting stuck, vomiting blood, black stools, anemia, or unexplained weight loss. Sometimes we use it for screening, for example, with long-term reflux or strong family history. Other tests exist, like Hpylori breath or stool tests, or a barium swallow. But if there are red flags, gastroscopy gives the clearest answer.
People get worried about safety. Is it dangerous?
It's a very safe test with a medical professional team. Most people notice only a mild sore throat or a bit of gas after. Serious problems, like bleeding or a tear, are rare. Before we start, we talk through benefits, risks, and other options. We adjust sedation to your age and health so you're comfortable.
Some people hear consent form and feel unsure. What does that mean?
It's a simple conversation plus a signature. We explain why we suggest the test, what it can help, what small risks exist, and what the alternatives are. You can ask questions, bring a family member, use an interpreter, and you're free to say yes or no. If anything isn't clear, we pause and explain again. If needed, we can delay or reschedule. Your understanding comes first.
What should patients tell their doctor before the test?
Please tell us about allergies to medicines, latex, tape grid adhesive, or past reactions to sedation or anesthesia, blood thinners, heart or lung problems, sleep apnea, past trouble with sedation, or if you might be pregnant. Routine antibiotics aren't needed for a standard scope.
What about allergies? How do they change the plan?
Allergy history helps us keep you safe. If you've reacted to sedation medicines, we choose alternatives and monitor closely. If you're allergic to latex or tapes, we use non-latex gloves and hypoallergenic dressings. If you've had severe drug reactions, bring the names and what happened. Tell us about asthma or past anaphylaxis. The more we know, the safer and smoother your day will be.
Some people say, I'm too old or I'm weak. Can they still do it?
Yes, age alone isn't a reason to avoid the test. Even frail patients can do it safely after a basic health check. We use gentle doses and monitor you throughout.
What about diabetes or high blood pressure?
Both are common and manageable. Because you'll be fasting, diabetes tablets and insulin are usually held that morning to avoid low sugar. Bring your meter. Often, we'll check before and after. Most blood pressure tablets are taken with a small sip of water. In some centers, certain blood pressure medicines are held on the morning of the test. Follow your doctor's plan.
And kidney disease?
The scope doesn't use contrast dye, so it's generally safe for the kidneys. We may lower sedation doses and keep a closer eye on you.
My uncle has liver cirrhosis. Can he have this scope?
Yes, and in cirrhosis, it's often important. We use gastroscopy to look for and treat swollen veins in the esophagus that can bleed. We do it with full monitoring, check clotting and platelets first, and use gentle sedation. It's about safety and prevention.
People hear nothing by mouth and get confused. What does that really mean?
No solid food for 6 to 8 hours before the test. Some centers allow clear liquids up to 2 hours before. Ask your team first. Skip smoking, alcohol, and chewing gum. Bring your medicine list, and please arrange a ride home. You'll feel sleepy from sedation.
If someone takes daily medicines, what should they do that morning?
Take essential heart or blood pressure tablets with a small sip of water unless your doctor says to hold them. Hold diabetes tablets and insulin that morning to prevent low sugar while fasting. Blood thinners are planned case by case, so we'll give you written timing before the day. For a simple diagnostic scope with small biopsies, many people continue their daily antiplatelet, for example, low-dose aspirin, but this is confirmed with your doctor. Other blood thinners may need a pause, sometimes 24 to 48 hours, and in some cases up to 5 days, depending on your clotting risk and whether we plan treatment during the scope.
How long should a patient on blood thinners stop before the procedure?
Timing depends on your exact medicine, clotting risk, and whether we're planning treatment or just a look. Some are paused 1 to 2 days, others several days, and a few are continued. Your doctor will set the timing and, if needed, arrange a temporary alternative. Never stop a blood thinner on your own. Follow the written plan we give you.
What if someone is already taking acid tablets or just finished antibiotics?
If we're checking for Hpylori or inflammation with biopsies, we often stop acid-reducing tablets for 1 to 2 weeks and avoid recent antibiotics or bismuth for about 4 weeks. These can hide bacteria and cause false negatives. If you have severe reflux or bleeding, we may keep the acid-reducing tablets for safety. We balance accuracy and protection for you.
During the test, what will the patient feel and how long does it take?
The scope itself takes about 5 to 15 minutes. With check-in and recovery, plan 1 to 2 hours at the clinic. We use numbing throat spray and light sedation. Most people feel drowsy and comfortable and remember little. You might feel a puff of air in the stomach or a brief gag at the start. It settles quickly.
Besides looking, what might you do during the scope?
We might take small biopsies, treat a tiny bleeding spot, gently widen and narrow area, or remove a small polyp. We monitor your oxygen, pulse, and blood pressure the whole time. If you look uncomfortable, we pause and adjust. Sedation makes some people nervous. How strong is it? Is it safe? For most people, it's light to moderate. You're sleepy and relaxed, but breathing on your own. A nurse watches you continuously, and a doctor is right there. In special cases, we use deeper anesthesia with an anesthesia team. If you use CPAP for sleep apnea, bring your machine or tell us so we can keep you safer. After sedation, you'll feel drowsy, so no driving, no alcohol, and no big decisions until tomorrow. Reactions are uncommon. Fasting, careful dosing, and close monitoring keep you safe.
After the test, how long do they stay? Do most people go home?
Yes. Most people rest for 30 to 60 minutes and go home the same day. If someone has serious heart or lung disease, heavy bleeding, or is very frail, we may observe longer or very rarely keep them overnight.
When can someone return to normal eating?
Start with small sips of water once you're fully awake. If that feels fine, move to soft foods later the same day. Most people return to normal meals by the next day unless your doctor gives different instructions.
What should someone expect at home that day?
A mild sore throat or some gas is normal. Start with water. If that's fine, soft foods later the same day. No driving, no alcohol, and no signing documents until the next day. Get help right away for severe chest or belly pain, fever, vomiting blood, black stools, trouble breathing, or nonstop vomiting.
People always ask about the biopsy. When will results be ready, and do they need to meet the doctor again?
Most results are ready in 3 to 7 working days. It can take longer if special tests are needed. Your clinic will call or set a review visit. Even if the report looks normal, it's good to talk it through so we can explain what it means, adjust medicines, and plan next steps. If you haven't heard after a week, it's fine to call and ask.
Can we end with the simple pros and cons?
Sure. The big plus is clear answers. You can see the problem, take biopsies, and sometimes fix things right away. Most side effects are mild and short-lived. Serious bleeding or a tear is rare, and we lower that risk by checking your health, managing medicines, and monitoring closely.
Before we close, can you give a very short recap?
Of course, what it is. A short camera test to look at the food pipe, stomach, and first part of the small intestine. When to do it. Persistent symptoms or red flags, like bleeding, black stools, anemia, weight loss, or food sticking. Safety. Generally very safe. Light sedation, continuous monitoring. Allergies and history. Tell us about drug, latex, tape, adhesive allergies, and any sedation reactions. Preparation. No solid food, 6 to 8 hours. Ask about clear liquids up to 2 hours. Bring your medicine list. Plan your ride home. Medicines. Follow the written plan for diabetes meds, blood pressure meds, and blood thinners. Ask about PPIs or antibiotics if Hpylori testing is planned. After, rest. Start with water, then soft foods, no driving or alcohol until tomorrow. Watch for warning signs. Biopsy results usually in 3 to 7 working days.
Before we close, a quick note for safety.
Medical disclaimer. This video is general education, not personal medical advice. Always follow your local clinic's instructions and speak with your own doctor before any test or treatment. Emergency. If you have severe chest or belly pain, trouble breathing, vomiting blood, or black stools, seek urgent care immediately.
That was clear and kind. Any last words for someone who feels scared?
Feeling nervous is normal. Remember, the test is short, safe, and meant to protect you. It gives early answers so we can act early. You won't do this alone. Your team will guide you step by step.
Thanks, Doctor. And thanks for watching. You're with Dr. Health Hub, where every episode begins with a doctor's tip you can trust. If this helped, please like, share, and subscribe. Your health is your wealth. See you next time.